grandchildren, or seeing someone do a kind deed, or talking about one's love for one's family. A patient will describe having these sudden onset of emotional symptoms that can often be very embarrassing and can lead the person to avoid circumstances where they're going to be feeling sentimental, such as a patient of mine who didn't want to give his grandson a gift because he knew that it would lead to excessive tearfulness. And often patients in this situation will think that they must have a depressive disorder because they're crying all the time. But when you point out to them that they're only crying in these sentimental circumstances, and they don't have a pervasive or persistent change in their mood, such as of the type that I spoke about earlier, with a decreased interest and decreased enjoyment or the pervasive sadness, they realize that this is just a feature of emotionalism or pathological crying or pathological tearfulness, or what can also be called emotional incontinence. And there are some patients who also have pathological laughter as a feature, but that's a little bit less common. Psychosis, the last of the two conditions I'll be speaking about, this is fairly prevalent also in Parkinson's disease, with rates of up to 40%, with it occurring more commonly when there is significant dementia in up to 80% of patients. It's a major clinical challenge, a major source of caregiver burden. Psychosis is the #1 factor in nursing home placement, and it's also associated with increased disability and mortality. Fortunately, the prognosis is improved with treatments that are available. Psychotic symptoms in Parkinson's include hallucinations, which are perceptions without a stimulus, and they can occur in any sensory modality, most commonly visual. Delusions are fixed false beliefs, and I'll speak more about those in a little bit. The hallucinations in Parkinson's fall into 3 categories. The minor hallucinations include a sense of presence, which is a vivid sensation in which one feels the sense of presence of someone perhaps being in the room, often a deceased relative or just someone in general. Passage hallucinations are brief visions in the peripheral field that pass by, often will be shadows or maybe a natural formed figure. And illusions, which are not strictly a hallucination, but are really sensory distortions. And so a person may look at a set of bushes, and they see a dog inside those bushes, or they look at a stick and it looks like a snake, or they might see a set of curtains and they see some figure within those curtains. Sometimes these are referred to as benign hallucinations or hallucinogens, but the term benign is debated, given that the presence of hallucinations themselves is potentially portends more problems to come. When patients have insight into the presence of these hallucinations, however, some people will regard these hallucinations as benign. Other patients will have hallucinations without insight when they don't recognize that they're actually hallucinating. And often in these cases you'll see formed or complex hallucinations that occur in any sensory modality: visual, auditory, olfactory, gustatory, somatic, or tactile, or even kinesthetic, which is the sense of one's body in space. The 1-year prevalence of these various hallucinations is about 29% of the minor hallucinations in one large series that took place in France, with about 40% of patients having minor hallucinations at 1-year follow-up. So what you see is an increased prevalence over time, with visual hallucinations being the most common. But again, about 40% of patients having any type of hallucination at baseline, but almost 50% of patients having at least one type of hallucination present at 1-year follow-up, with a 15% incidence rate. And what predicts the presence of hallucinations tends to be ocular disorders, axial signs, and sleep disorders. At 6-year follow-up, you see even more patients with hallucinations, with an overall prevalence at 72 months of 44%, but overall the odds ratio of having persistent hallucinations being 4.4. In other words, the presence of hallucinations suggests that once you have them, they're likely to persist, and that over time, more of your patients will develop hallucinations as time goes on. Delusions occur less frequently in Parkinson's disease, but still are present in up to about a third of patients, and they occur along many different types. Particularly common are delusions of spousal infidelity, which is a tremendous problem for the spouse who's often taking care of this patient very dutifully, and yet they're being accused of having affairs, which is really part of a delusion. They can be a feature of a mood disorder, but often they exist on their own. Delusions often accompany hallucinations, and the delusions can be secondary to those hallucinations. So if someone's seeing a person in the home, they may think that person is trying to steal for them, or they may have other persecutory delusions. There can also be delusions of influence or first-rank symptoms, such as a patient who felt that every time he would experience a tremor, that there was a neighbor down the street who was actually causing this tremor to increase. Or some people can have other kinds of passivity experiences of that nature, which their body is made to perform certain movements, or they feel rays passing through their body. So you can have more unusual delusional experiences that you might typically observe in a patient, for example, with a schizophrenia diagnosis. But these can also occur in Parkinson's disease. We looked at the prevalence of hallucinations and delusions in our sample in the Hopkins longitudinal study, and what you see here is that about 22% of the sample had psychosis, with a total, with the majority of those patients who did have psychosis having hallucinations, and about 64% of those who did have psychosis having delusions. And you see here that you see a range of visual, auditory, olfactory, tactile, and visceral hallucinations, but visual hallucinations being the most common. And many patients with delusions had paranoid delusions, but about 25% of our patients had delusions of spousal infidelity. When a patient does have psychosis, they're often likely to have other associated psychiatric features: depression, anxiety, disinhibition. They may have gambling and hypersexuality and other symptoms that I'll describe later, as well as delirium and particularly caregiver strain. Here we show in this data from our Parkinson's longitudinal study that many patients with psychosis will have additional psychiatric comorbidities. So once you have one psychiatric problem, you're more likely to have more than one psychiatric problem. In this particular sample, we had 22% of the patients had psychosis, but of those patients with psychosis, over half of them had at least one additional psychiatric disorder, with depression being the most common comorbid psychiatric disorder, with 71% of patients having a concurrent depressive disorder and 21% having anxiety, as well as delirium being another common problem. Last, I'll speak about behavioral disturbances in Parkinson's disease, which have had more attention being paid to, although these have been reported even early in the descriptions of the use of anti-Parkinson therapy with levodopa back in the 60s, when it was treatment was first with levodopa was first initiated. There were descriptions of patients having hypersexuality. Now what we've been seeing in the literature is pathological gambling, hypersexuality, pathological shopping, a condition called punding, and compulsive dopaminergic use. So pathological gambling, just to briefly review, these are patients with recurrent maladaptive gambling behaviors who cannot resist the impulse to gamble despite the social consequences. It can occur with all forms of gambling, with some patients losing up to $700,000 among the people whom I've seen. And along with this, you may see an increased suicidal risk, as well as problems with abuse of the dopaminergic medications. The prevalence in Parkinson's is up to 8%, as compared to the U.S. adult population having about 3% rates. Hypersexuality is another common problem. I'll just review these briefly, with the prevalence in Parkinson's disease being up to about 3%, and a variety of forms of hypersexuality basically being presenting with an excessive sexual drive or the development